Dr. Mahmood Buttar is a man on a mission. In 2006, he wrote a paper for the BMJ exposing the murky market in medical supplies. He uncovered the appalling working conditions and use of child labour in the production of surgical instruments that are used in the NHS. And since the publication of this paper, Dr. Buttar has helped found the BMA's Medical Fair and Ethical Trade Group, which is launching a campaign to get doctors involved in changing the purchasing habits of people in the NHS. Dr. Buttar, you visited some of the factories producing surgical instruments in Pakistan. Can you describe the working conditions you saw there?
It's basically sweatshop labour. I mean, these people who are making these instruments are working terribly long hours. They work sort of 12 hours a day, 7 days a week. They get paid very poorly, and they're exposed to sort of terrible health and safety hazards with all sorts of machinery and chemicals, and without really adequate protection. As well as adults producing this, what I also saw that there were children in the surgical instruments industry. There are several thousand children working to make products, including for the National Health Service, and some of those as young as 7. But what I also wanted to say is it's not just about surgical instruments. We also have evidence that there's other medical products, such as textiles and uniforms for nurses and so on, that are also produced under unethical conditions. And so really this is a broad question, asking how much of the goods that we're purchasing in the NHS are produced ethically.
With all the talk about cuts to NHS funding, can we afford fair trade goods?
First of all, it doesn't have to cost more. I mean, there's a common misconception, but actually fair trade goods can either be cost neutral or cheaper. The whole idea of fair trade is that the end supplier works much more closely with the manufacturer to ensure that they're monitoring labour standards and so on. And by doing so, they cut out a lot of the middlemen. And so actually the cost doesn't have to be higher, and in many cases can actually be less. But there's also a second point here, and that is, well, even if in some cases it does cost more, we have to show some moral leadership here, I think. And so rather than just thinking about the cost of everything, which is important, we do need to keep public expenses down. We also need to consider, however, the environmental and social impact of what we are buying, and so that in safeguarding health in the UK, we are not actually harming the health of others elsewhere in the world.
Sure. I mean, returning to the kind of conditions in Pakistan, are you not worried that if we start to boycott goods from these countries, it will destroy local economies and potentially put desperately poor people out of work?
Yes. I mean, you're absolutely right. We have to be very careful. I mean, I think to boycott goods is completely the wrong response. Those sorts of responses we've seen in the past, and actually, as you would expect, it just harms the people even more. I mean, they're reliant on this income, however little it may be. So it's complicated, and I think what we need to say is, yes, we need a process of improvement, rather than saying, well, look, you must certify to a certain standard to even supply the National Health Service. I mean, a lot of people who are in very poor situations may not have the investment or the infrastructure to be able to reach those standards. And so really it's a case of careful, measured response. And so saying, okay, well, what we need is for you to be transparent about how things are being made, transparent about the problems, and let's all work together to see how we can solve those over years. I mean, this is a long-term process, and we should be in it for the long term. We should make a commitment to the people who are helping to save British lives.
So what can ordinary doctors do to help?
Well, I think doctors are the key here. I mean, they really do hold quite a lot of power within the hospital. The BMA and the Medical Fair and Ethical Trade Group have launched a campaign, and there's 4 things you can do. The first thing is to ask your chief executive to adopt some ethical procurement into the institution's policy. There is some guidance from the Department of Health, and that makes it quite clear how you can become an ethical institution. The second thing is to ask healthcare suppliers where and under what conditions they produce their goods. And if you just start asking the question, that can really affect change in the supply chain. The third thing is to try and join with your colleagues to form a group and really get this working in action, to exchange ideas and to support each other. And the fourth thing is to try and tell other people and spread the word. The more people that are asking these questions, the more chance we have of affecting real change.
If you would like to find out more about the BMA's campaign, you can visit their website at www.fairmedtrade.org.uk. Alternatively, if you're on Facebook, you can join the Fair Med Trade Facebook group.